call me Richard.
Richard. Okay, Richard. Hi.
Yeah.
So I'm
Okay,
here today.
Yeah. So hi.
I'm here today with Dr. Richard Cheng, who's in China, and with Ron Svensson, who is a historian for use of vitamin C and in treating viruses. And we're looking to discuss what we can use to save lives right now, because what we have across the world is a 20 to 21% rate of death for those people that are identified as having the coronavirus. And for those people in New York right now, the number took a pop again. For those people who are identified as having the coronavirus, if their case resolves, we now have hit a point of 40% death rate in New York for those cases. 40% of them who are resolved are ended fatally. So, Dr. Cheng, we're very interested in what you have to say and what you're discovering and the studies going on in China. Dr. Cheng?
All right, thank you very much.
Yes, sir.
Much for having me. Yeah, hi, Ms. Fisher.
Yeah,
hi. From what I know about, yeah, can you hear me?
Yes, we can.
Can you hear? Okay, yeah. Well, basically, from my perspective, I feel an integrative approach to any diseases, including the COVID-19, is more appropriate, not a drug or a. The reason I highlight vitamin C is because I want to get a message through. And so talking about vitamin C, and we know vitamin C, I'm not going to go back to the history. Vitamin C has a long history around, can give you a better, because he worked with the pioneer, Dr. Cathcart, in the past. So when COVID-19 just broke out, I started calling for high dose vitamin C to be used. And so let me give you some preliminary data here in China. The two prominent ones, or relatively larger ones, are one in Shanghai and in Wuhan. Wuhan, as you know, is the epicenter of this pandemic. And the world's first high-dose IVC trial was Dr. Peng's group in Wuhan. And we interviewed him not long ago. I just said, I keep communicate with him regularly. And so that group, they were able to recruit 40-some patients altogether. And of course, early on, it was designed as a RCT. But the good news is that the COVID-19 quickly sort of passed over peak and is on the decline here in China. And so that's good news. The bad news is that for this IVC trial, they ran out of patients. So they couldn't recruit any more patients. So they had to redesign the protocol to make any useful information out of it. But the preliminary data from this trial was that again they were using 24 grams of vitamin C IV a day, and the preliminary data shows that the high dose vitamin C is able to reduce the inflammation significantly among the COVID-19 patients compared to the controls. And also the hospital stay and also the stay in ICU appears to be reduced significantly as well. On top of that, the mortality rate, just by looking at the numbers, is also reduced significantly. Of course, these are all preliminary data. They have to go through rigorous statistical analyses and to be published eventually. But those are some of the preliminary data. And so coming back to Shanghai, and a little over a month ago, we had a video conference with one of the, actually we was two, was Dr. Mao in particular, one of the senior experts on the expert panel in Shanghai. The way they deal with here in China is that all these patients will be centralized in certain healthcare facility, as you understand. Shanghai, at that time, there weren't that many patients. Over a month ago, it was 358. And this group was able to treat about 50 of them with high-dose vitamin C. The doses used were 10 to 20 grams a day. And again, this is not a controlled trial setting. It is more of a clinical treatment setting. And so they gave 10 grams to moderately sick patients, and 20 grams to severely sick patients. How do we define? Basically by the pulmonary or the blood oxygenation saturation index, because SARS-CoV-2, this virus, particularly affects the pulmonary system. The preliminary data again is that first of all of these 50 patients recovered, no deaths at all. The total fatality out of 358 at the time was 3, so it was low as well. None of those 3 unfortunately died, had IVC, and that's one. Number 2 was the recovery. Basically, the high-dose vitamin C group seemed to recover faster. They also had a shorter ICU stay and hospital. The discharge guideline here in China is that they have to be negative on the test before they can be discharged. And so hello, I'm sorry.
You're back.
I think
You're having intermittent bandwidth problems. Yeah.
Yeah, it was also a phone call coming. I have to turn it off. But the hospital stay for average people before they turn negative on the test, it was 30 days. And the high-dose vitamin C group was about 5 days shorter, about 25 days-ish. So that's another significant data. And in particular, out of those high-dose vitamin C patients, I'm sorry,
No worries, doctor.
Hello. Yeah,
we're back.
They don't get a message. When I turn it off, that means I can't answer right now.
Yes.
So the other significant, I think that's important. I want people to know this is that in one particular case, at least, the patient, a senior patient, high-risk group patient, was deteriorating very rapidly. Basically, the pulmonary function, the patient was very rapidly going into respiratory difficulties. So the doctor gave him, they gave him a 50 grams. This is the high dose. That's the dose I like, actually. 50 grams IV infusion over 4 hours. So that's pretty quick. Because at this high dose, we can really reach the optimal. The mouse group reported that you can see real-time improvement of oxygenation index. Now that's very important, although that's one case. However, if you look at the history, this is not the first time we see it, okay? So this is the data. So in relatively large groups, here we're talking about 40-some patients, 50-some patients studies. Of course, these data are still preliminary, but are very promising. We have to put things in the context of the decades of vitamin C research. And I have other individual case histories we may not have to go into. And also the recent US case, back in America, is from LA Times. I'm sure you are more familiar than I am. And so what I want to point out here, one issue, I think this is fundamental, is that we seem like as a whole, particularly the medical, in the medicine, in the industry, or even the outside lay people, we seem to look at COVID-19 as a brand new disease. And we have to study this COVID-19 from scratch. And this has nothing to do with other studies we know of. Now, I think that is a problem. Yes, SARS-CoV-2 is a brand new virus. And what caused COVID-19, it does have its characteristics. For example, it spreads very rapidly. It seems to linger around much longer. It seems to be more severe, probably a higher in mortality rate. However, if we look at the biochemical or pathological mechanisms, COVID-19 shares a lot in common with others. COVID-19 or SARS-CoV-2 infection is not scary if it doesn't cause a lot of morbidity or mortality, meaning if it doesn't cause a lot of people to be very sick, or if it doesn't cause a lot of deaths, it would be just like a common cold. So what's really important underlying COVID-19 is because, as we know, we've heard on the website, is of this cytokine storm, basically sudden release of a lot of free radicals. And that in turn causes a lot of cellular damage. Now, these damages in COVID-19 primarily happen in the lungs, but it can happen in other places, in livers, in kidneys, in liver, in kidneys, and in our blood vessels. This is not unique to COVID-19. That's the key. We know, we don't have to go far. SARS, 17 years ago, had a similar findings. For example, what we know of, the respiratory distress, acute respiratory distress syndrome, or we call it ARDS. And this is the key underlying pathology of COVID-19 that leads to severe morbidity and high death rate. Now, ARDS, as we know, I mentioned, happened in SARS, happened to MERS 7-8 years ago, and it happened to any other viral infections or other toxins or pathogens that primarily affects the lungs. And other viruses that may affect, for example, like I mentioned, liver or kidney, the mechanism is very similar again. It's also these pathogens induce the sudden release a lot of cytokines that our body can, basically like a friendly fire. Our body can't handle that much oxidizing effects. Mm-hmm. This is something in common. Okay, and that's where the vitamin C and other, you already mentioned that, sir, when you started, is that the other, for example, vitamin D, the zinc, the antioxidants, selenium, or these are the antioxidants. So this is not vitamin C. Basically, here I think there are two key issues here. One is we want to cure the virus. Viral killing that's important, of course. The second is how we can prevent, reduce the secondary damaging side effects of the viral infection.
Right.
Yeah, to me, this is probably more important than the virus killing. And we cannot separate the functions of vitamin C or these what I call also molecular or integrated medicine approach. So now we identified, as you may know, that I was invited to give a lecture at NIH on the science behind the vitamin C and COVID-19. And so I pointed out in that seminar is that the key here is the exuberant oxidative stress. And that is the key player here. And if we are able to target this mechanism, preventing it from happening or reducing it if it's already there, that I think is the key thing underlying here. And we need to take an integrative approach. All the things you mentioned plus more will help here. But of course, so far I've been primarily talking on vitamin C is because I want to get a message through. Not that if I had a choice,
When I'm looking at this, and when I see secondary infection later on, or where it seems to be reoccurring COVID-19, it looks like it's just breaking at the weakest link. So when some people are finding some other cure, and they report, some people are saying they're taking quinine water and zinc and they're getting better. Some people are saying large doses of vitamin D. I think, without getting into the mechanisms of how every single vitamin works, it's some kind of weakest link phenomena is occurring, because sometimes vitamin C clears them right up, and sometimes it requires a cocktail. So,
so I think here,
go ahead.
You're absolutely right. Is that I think we're looking at this disease and other diseases. Actually, this is reflecting a deeper problem in our current medicine, is that we're looking at this issue in a piecemeal manner. For example, I get a lot of emails every day like you, and one of the recent emails asking me this virus is hiding in the testicles, how we can do it. The virus is affecting the hemoglobin, issues. Well, these are all phenomena. These are all the presentations. Well, you have to look at the underlying mechanism. And so what we need is an integrative. For example, what we know, no argument here, is that seeing like the high-risk group, basically people with underlying chronic diseases are more prone to develop more severe diseases and also with a higher mortality. Why is that? This clearly tells us because the body's immune mechanism and also body's compensating mechanism is already damaged. On top of that, you receive another, last straw or the hay on the camel's back. So yes. We have
bandwidth again.
To look at these issues collectively, and what we really, including Harvard, collectively or integratively. Yeah.
Yes. Okay. So looking at the studies, though, and I do want to get back to liposomal and oral vitamin C because that hasn't been mentioned in these protocols yet. But it looks like going for the single bullet theory as to a real cure, if they're depleted in other nutrients, it doesn't seem like that's necessarily a long-term solution, but it seems like the high-dose vitamin C might just be like the cavalry. It's coming over to reduce the oxidative stress, and then when that depletes again, there's other nutrient deficiencies, and they will present themselves again, possibly. But yeah,
yes.
Okay, let me let you go, please.
Yeah. Oh, I was gonna say, yeah, the interdependence of these different nutrients to make our body's machine working. We shouldn't be looking at one or two. Again, this goes to the integrated medicine concept. Is that one? It's these things. We have to understand. One virus or other toxins or other diseases affect us. It affects the whole body. Yes. So I summarize in 3 views. We have to look at health and disease holistically or integratively. When need to start, it again feels into the line of nutrients. And the second is the balanced view. Because our body, the optimal health requires the balanced action of these nutrients, not just one. And it's a balanced view. The thirdly is also importantly is the natural view, I believe, is that I am not against the man-made drugs. I am not against the vaccines, but every treatment or prevention tool has its shortcomings and effects. We all understand this. To me, hospitals exist for a reason. The current medical system exists for a reason. In acute care, they're particularly good, right? Because somebody has an acute heart attack, you come to me, I can't do anything about it, right? Because I'm not in that field anymore. So, however, as we understand, when the acute phase of the disease is over, and if there's a lingering chronic disease effect, we have to go back to the health maintenance to function optimally. To me, we need the original parts of any machinery system. I oftentimes use synergy. Analogy. That's very simple to understand. I think if I drive a Honda car, and my car breaks down, and you come in, I'm trying to replace Honda car with a Honda part. You come over, sir. Here I have a better part. I have a Mercedes-Benz part for you. Would I need it? No, it doesn't fit in my Honda car. So that's the concept. Is that to optimally function for our body, we need the natural molecules as much as possible. Again, I am not against the synthetic drugs. Everything serves a purpose. But if we only look at the vaccine or drug, maybe we're missing a point. And so those are the 3 views of mine: holistic or integrative, natural and balanced. So in dealing with health, particularly chronically health and disease, that's how I approach the disease and health.
You know, now let me ask you a slightly different question. With this drop-off, sudden drop-off in Chinese mortality related to COVID-19 and even infection rate, what else happened in China to cause that? Why are the numbers exploding in New York State, even the lesser dense parts of New York State versus China with its 1.3 and change billion population? How did that happen?
Yeah. Okay, good. Let me mention 3 points here, because the one point you mentioned earlier, I forgot to answer. I asked this question specifically to both the Wuhan and Shanghai group. Did they use other treatment methods than vitamin C? And the answer is no. Other than the supportive care, you know, the intubation, oxygenation, and one of the other key factors is heparin. As we know, this type of significant cytokine storm, they may, like I mentioned, that they will cause ARDS and called microangiopathy, basically. So these underlying, you know, the problem is that these patients may tend to clot more easily. So heparin or the anti-coagulant is a common, again, this is a supportive care. It's not any specific drug, okay? So they didn't use, for these patients, they didn't use, you know, traditional Chinese medical medicines or the other things. Let me make that clear. And one other reason why the group was not able to recruit more patients was also suddenly a lot of studies, particularly a lot of Chinese herbal medicines, they are all competing for patients. So I guess, you know, that answers that question. Now, the second point I forgot to mention is that this is important, I think, is that, you know, you may remember seeing a news piece saying that 50-ton truck was delivering vitamin C to Wuhan back, I think that was in February. What I learned was that in Wuhan city, at least, all the major hospitals, healthcare providers were given vitamin C powder. They were encouraged to take a couple of grams a day. Now, I think that's significant. I didn't see news report of it. And this was an oral communication from Dr. Pan on the ground, in ground zero. And I think the healthcare providers and the government over there recognize the oral vitamin C's power here. So they, well, the third question, to answer your question directly, why is this a sudden drop? I think there may be two reasons here. One is that, you know, instinctively, I do think there's a sudden drop. And it's not just on the statistics. And I do feel, and I do sense the drop of this COVID-19 cases. And this may have to do with the lockdown, strict policy. And back early, you know, that's back in February, you know, when you go on the streets, that's very eerie. It's scary because big city like Shanghai with 20-some million people, ordinarily, there were no people out there. I've never seen that before. And so probably people do follow these. And also, I mean, it's like a wartime. It really reminds me of the World War II movies, okay? I didn't experience that. So basically, you go into a community, you go to the residential area, you go to other places, there are these guards out there. You know, you can't go in or you can't go out. So that's very strictly enforced. And as we were with Dr. Peng under the international Zoom video conference, he was saying, if anybody walking on the street without a mask, they will be grabbed up and arrested, or, you know, locked away somewhere. So I think the strict enforcement of these policies, I do feel they played a significant role.
And the other part, infection rate a lot. Yeah, infection rate would be grossly attenuated.
Exactly. Yeah, the other is whether the statistics, you know, and you know, whether it's reliable or not. You know, what I can tell is that I think it has to do with how we got the statistics. For example, one of the facts is that they were only testing those people in the hospital. And we do know a lot of people probably suffered and died at home from the infection. and they didn't check and they didn't count. So how we collected the data. So my point is that I really feel that the real, the morbidity and the infection rate and the death rate is higher. But depending on how you assay that, if you go back to check, many of them already probably gone, and so that's that.
Yeah, and unless people are presenting with some kind of symptom, they don't get tested. So we don't know if they're infected or not, because what
Yes.
we have at the moment, we have an average temperature in Wuhan that's close to 20 degrees higher than New York State average temperature. So that's an issue for straight flu season thermodynamics, for lack of a better word. Flus come when the air temperature is lower and you have a much more fit environment for incubation in the bronchi and lungs. So we have a temperature difference. So
yes, that's right.
That's what creates flu season, is the incubation, the preferred incubation temperatures for the virus. So maybe we're fooling ourselves. Maybe this is just part of the puzzle. And if somebody sneezes for an allergy over the summer, they've spread coronavirus, which will not manifest until winter.
Yeah.
And that will be China, that will be the United States, that will be Italy.
Well, actually, I'm just reviewing a paper. I guess it's okay to say it should be published soon, from Dr. Paul Merrick. As you know, he's pretty well known in the field. His group recently did a study analyzing the vitamin D level, basically the case treatment mortality. He found out that the death rate from COVID-19 is higher in the northern states of the United States than the southern ones. And he had a list of individual states. And actually, I'm asked to review, and I should finish it today. So it correlates with vitamin D level, as you mentioned earlier, because in the northern parts, northern latitude, the vitamin D level drops off pretty quickly. So we need to boost vitamin D.
Definitely correlate. But then we're also noticing anecdotal stories of self-healing where people are raising their body temperatures with saunas or hot baths, and they're increasing the humidity of the air that they're breathing with that sauna or hot bath, and then they're finding a reduction of symptoms. So again, I'm looking at what's the most common thing during flu season, even before you hit the peak summer months, and you just have air temperature. Now, if you're isolating people and putting them indoors, what also changes instantly is air temperature. Yeah.
That's a very good point, Ms. Fischer, to mention that, is that one of our current problems, I think it's particularly in the United States, is that when somebody has a fever, we rush to reduce that fever. That's a problem with current medicine.
That's a problem with coronavirus, quite frankly. If they're under 100,
yes, absolutely.
I am telling people not to reduce. I'm telling them not to take any fever reducers at all. Under 103,
absolutely.
Let it go.
Yes, I agree. I think there are 2 points here I want to mention here about temperatures. Number one, if the temperatures goes up, if it doesn't bother you, if you can tolerate, let it run a little bit, because that's our body's natural defense to render the viral proteins, inactive. That's very important. If it goes very high, I would advise try to use physical means, cold bath or ice pack on the carotid area. I would avoid to use let's not mention about drug names, the chemicals, because these things will
well, let's talk about them, because I do.
Immune system, particularly right now.
Right, then they cause liver stress, and there's other issues. Whether you're talking about Advil or Tylenol, or whatever the other one. They all cause those issues. They affect glutathione. There's a lot they do that may not help here. But instead of carotid, I would actually suggest putting ice packs on femoral, because if you're putting on carotid,
femoral,
throat temperature. So I would do it femoral, not carotid. But I agree with you. This thing is like what Mother Nature intended, which was burn it out. Burn it out, because it's trying to incubate something else.
I think you're a doctor.
Everybody
Yes.
thinks I'm everything. They think I'm a lawyer. They think I'm
Yeah.
a car mechanic. I read books.
Oh, you speak medical language.
I read books. The
Very
wisdom of the
knowledgeable, sir.
universe as we know it is contained in books.
Yeah. Yeah.
So, Dr. Cheng, Richard, I want to explore how you integrated with the people in China, and how did this come out of the woodwork? How did it get discovered and propagated? And the third question that is
Okay.
how did it? How is it going now? How far has the solution propagated so far?
Yeah, that's a good question, Ron. Yeah, call me Richard, please. Yeah. Is that for the past couple of years, as I am getting older, so I'm particularly interested in health maintenance, anti-aging, so to speak, So I got into these integrative medicine or anti-aging medicine. And so I knew about Dr. Pauling's work 20-some years ago when I was still in a training program. And but anyway, long story short, for the past couple of years, I've been coming back to China, to spend time with my parents, and also talking at various conferences, medical conferences. And so I met quite a few, several doctors or in academia or public hospitals who share the same passion or same understanding like I do. And actually, there are doctors in China using high-dose vitamin C. And Dr. Ma, I mentioned earlier in Shanghai, he's been using he's an emergency physician, and later on, he's being the critical care, the sort of, related fields. So he's been using high-dose vitamin C in sepsis, in wound healing, in that field. And he's one of I think he's the first one that I know of. I don't know if he's the only one, but that's the only one I know using this. But also, I have known at least two doctors, one in Wuhan, one in Beijing, using high-dose. Later on, there's another group in southern China using high-dose vitamin C in treating cancer patients. So we do know, I don't know a whole lot. There may be more that I don't know. But I do know a handful of doctors in China using high-dose vitamin C in those various medical situations. But it never really formed a trend, and and so I, published some books and papers on vitamin C here in China, in Chinese, and I translate some books as well. And basically, I know, again, my interest is primarily in the chronic disease, but I also know the history of vitamin C, as you mentioned, it was started from, including Dr. Kaskov. And so when this COVID-19 broke out, and when Wuhan was locked down, I sensed the urgency there, the significance. So I got together with these doctors. I said, look, because there's nothing else we can do. I mean, even today, worldwide, other than the supportive care and a few drugs, we're talking about, only 2 or 3, So those things were not available when COVID-19 just broke out. So I told them, I say, we know vitamin C is safe. The key here about vitamin C is, number one, it's very safe. As doctors, we don't do harm to patients, right? Long record. And NIH has an official document saying high-dose vitamin C. We're talking about around 100 grams of vitamin C a day. For the vast majority of people, it is very safe and without side effects. So feel free to use it, number one. Number two, lots of research in the history. Let me also mention this number here. It's critical, is that there are very, very few molecules worldwide that have received this much study on as much as vitamin C. PubMed, the world's largest medical library hosted at the NIH. It's called PubMed.com. Our audience should know is that there are over 65,000 articles on vitamin C. These are peer-reviewed scientific articles. not including newspaper or these so-called non-scientific media. 65,000 in the library. I don't know any other molecule. There may be, but I don't know. I don't know any other molecule that has been studied as much as vitamin C. So anybody tells me that we need more research, I tell them, please do your homework first.
Absolutely.
Before you open your mouth, do your homework, do your due diligence.
Absolutely.
Yeah, so that's the thing. So let me finish that story. Is that so? I basically united a few scholars, medical doctors together, and so we formed along with Dr. Levy, as you know, and Dr. Anagisawa of the international, he's the president of ISOM, and also Andrew Sauer and Dr. Cheng from KUMC. A few of the scholars well known in the vitamin C field. So we formed this international medical IVC group. We started publishing articles, sending out the information, consulting for these various doctors. So, and also because some of doctors in the past have used this, they feel emboldened. I think that's the key, is that we need to educate the doctors and leaders, so not to be afraid of vitamin C. This is important because through my recent dealings with these media, actually I was surprised. I thought a lot of people were against vitamin C. Actually, I was wrong. Is the vast majority of people out there don't know about vitamin C. And typically, I would receive these, editor-in-chief in these newspapers. They said, if vitamin C is so powerful and safe, why we don't use it? I say, that's a good question. Why don't we use it? So, of course, I start giving them these information. So I think that education is key here, is that we need to let people know, number one, vitamin C is very safe. Number two, there's tons of research in the past that showing vitamin C is very promising. Actually, to me, that's conclusive enough. We have 65,000 research papers. Will another 65,000 research paper be enough? Or how much do we need? How much do we need, really? So,
well, I actually know from going on the internet and social media and just announcing vitamin C as a cure for coronavirus, because I've, caused the administration of various people in various stages of the disease and seen them all come back. And anybody near me, I hadn't had one fatality. Even oral vitamin C has gotten people ambulatory after they've been on the bed for 3 weeks. So, I still, when I post on social media, I get a large number of people that say it's junk science. They love that word, junk science. And so somehow it has a myth about it. And what we know about myth in the world is myth can often be more powerful than truth. And that is unfortunately what I see going on here. It is myth. It is a thing of legend and conditioning. And people are content to wait for a vaccine. They really look at the possibility of waiting a year, 18 months for a vaccine versus going outside when they don't realize that with an RNA virus, they may never see a vaccine, ever. That's a possibility.
Yes. Yeah. Yeah. So can I comment on vaccine a little bit?
Please.
Well, I'd like you to finish up my earlier question. You had an active role in getting this out into the open in Shanghai. I gather you say Beijing and down south in southern China. So what was your critical role in this? Were you the one that kind of got them focused because they were not sure of themselves? How did you, I'm talking about the dynamics between you and the other doctors.
Yeah.
And
Okay.
It's propagating.
Yeah. Yes, actually, and now I'm an old guy. I mean, so many of my former schoolmates, classmates, and they are in leadership positions now, whether in the government, health administration, and or medical field. So I do know quite a few of them, and so I tried my best. So we actually our message was delivered to all the way to the top in the government, in the central government. So I know they heard the message, and the top leader, as you understand, this when we go to that level, it becomes more political than medical. And although nobody truly confirmed to me how much, my opinion, or our opinion weighed, I do know that secretly or privately, they send me messages thanking me for alerting to this. I think the key here is that, again, like I mentioned, a lot of people don't really know, because talking about medicine, usually we think about drugs. And also, like I mentioned earlier, when we have a new virus coming out, we view it as a totally different disease. We need to start from scratch, studying it and everything. We don't think about what we have learned already. And so now I mentioned to them, I said vitamin C actually is a universal, powerful antimicrobial. It doesn't really matter, because the mechanism, one of the key mechanisms here of vitamin C is that when you have high dose of vitamin C, as you are better than I am probably, is that vitamin C gets oxidized in the body, and in that process, it creates hydrogen peroxide. We all know hydrogen peroxide is a household name of disinfectant. It kills any germ untouched. So the same thing here is that we're hoping to generate enough hydrogen peroxide to kill the virus. So this is a very key message I want to learn. And also this is related to the next question about future of vaccine, is that I think that's critical, is that, again, vitamin C is able to cure virus directly through at least hydrogen peroxide production. Vitamin C also has immune boosting effects through upregulating, for example, our T cells or natural killer cells, these, defense molecules to kill invading pathogens. And these mechanisms are not pathogen specific. It means that it doesn't matter what a virus or bacteria is coming in. We don't have to develop a new antiviral drug. We already have it. So if I miss anything, I'll come back to this later, Ram. But I want to talk about this vaccine a little bit. Again, I wish we had a vaccine 4 months ago. I wish we have a vaccine today. We can immunize every non-infected person on the globe to prevent the spread of this. I can come back to the United States, because right now I'm stuck here in Shanghai. And so, but unfortunately, the fact is we don't have a vaccine available to us. And if you read the reports, I'm sure we are all aware of the most optimistic guesstimate is probably at least 1 year out before we see a vaccine for anybody to use. More realistically, maybe a year and a half or 2 years. And like Ms. Fischer just mentioned, we may not even see a vaccine ultimately. Why? Because, Ms. Fischer really, I thought he's a doctor, But anyway, there's an RNA virus. It mutates faster. It mutates faster than we can create a vaccine. So here, let me talk a little bit about vaccine. I'm not an epidemiologist. I'm not a virologist. I'm not a vaccine expert. However, this COVID-19, made everybody to think about this, is that I began to read about it. This is scary. I didn't realize. I don't know if you guys. Let me give you some facts. If you look at the WHO, FDA or Wikipedia, this century, 21st century, in the short 20 years, we already have 60-some epidemics and pandemics. I think the number was 63 last time I counted. And if you go back to 200 years before, the 19th century and 20th century, on the website, there's a list of 90-some, I think it was 96, less than 100, 90-some epidemics and the pandemics. Now think again. In the 200 years before, we had close to 100, epidemic episodes. And in the 20 years, which is 10% only, we have already seen 60-some episodes. This is scary, because this would suggest the epidemics and the pandemics are on the rise. Mm-hmm. Okay, I thought epidemics, pandemics are related to our economic status, hygiene, I think there's no argument here that our hygiene and economy is better than 200 years ago. But why are we seeing an increasing trend? That's number one. Number two, a couple of days ago, BBC ran an article. It points the same fact that I just pointed out, is that there seems to be a rising trend of these, in particular, of new viruses. That's scary. For example, polio or these other known viruses or pathogens, some of them we have vaccines. Vaccines are great. Vaccines are good at preventing recurrent infection. If somebody already has the SARS-CoV-2 infection, vaccine doesn't work. So yes, vaccines are good at preventing these. The problem is, some of them, of course, vaccine has its side effects, like any other drugs too. The problem is for brand new epidemics, like COVID-19. The SARS-CoV-2 is a brand new virus. Remember, 17 years ago, SARS was a brand new virus. 8 years ago, MERS was a brand new virus. Zika virus, when it came out, was a brand new. Marburg.
Lost bandwidth again.
Yeah.
Ebola, all these viruses, when they look about 400% times faster. So we begin to see more and more new viruses coming out. Here is a problem. The problem is we will be hit by another new viral epidemic very, very soon in the future. Like I mentioned, 60-some epidemics in the century of 20 years. That's 3 times each year on average. So when we are hit right now, we are in the middle of COVID-19. I don't know, I hope not, but it will happen. We cannot live in dreams. When the next epidemic or pandemic of another new virus hits us again, are we going to panic like what we are now again? Let's analyze a little bit about vaccine. We already talked about vaccine. Vaccine is in reaction to a new occurring virus, in this case, viral vaccine. And so we cannot predict something that has not happened.
Correct.
So that's the nature of vaccine. So this time, for example, when the COVID-19, the SARS-2 virus came out, scientists begin to isolate, begins to sequence and analyze the viral structures. And then we design vaccine. The vaccine has to prove through the clinical trials to prove that it's safe and effective. And then if it's safe and effective, then we have to go through the mass production for everybody and the distribution. So the R&D, research and development of a vaccine, takes a long time. What I know, I'm not expert in that field, is that at least it will take a couple of years for a vaccine to come out, if we are able to produce a vaccine at all. There has never been a vaccine in the history of mankind that was developed in a timely manner to stop an ongoing first-time epidemic or pandemic.
It could be very,
Never.
very dangerous. Could be very dangerous.
And
never.
Furthermore, if you impart a vaccine during an epidemic or pandemic, you might actually accelerate the disease in someone. If you have somebody who's positive and you don't know it, you give them the vaccine, their system is already depleted, that vaccine is going to be even worse on them.
We have to remember the vaccines have immune synergizers in them to make them be more effective. Almost all vaccines are formulated on a pandemic model. They're formulated to take effect quickly. And it's not just flu vaccine that's constructed that way. All flus are pandemic, so they want them accelerated to quell the pandemic, to quell the epidemic. So what actually happens is it's not just the strain that you might have. So you might have live COVID-19 at the same time as you're being administered attenuated or deadened COVID-19, and you have the immune synergizers in there. So yes, your point is that it will excite that live strain. Now, what if it's another strain? What if it's a completely different strain, another novel strain? Now you've excited that. What if it's an allergy to latex or dairy or eggs or wheat? Now you've excited that. Whether you're exciting the immune system and throwing fire on the immune system, it doesn't discriminate as to what it should be igniting. So we wind up with not just this issue of vaccines and the pandemic nature of flus and the nature of having a lot of immunoexciters in the vaccine. We wind up with what are exponential injuries based on allergies. So all allergies are not necessarily linear when you add vaccines to the mix. So you might have a latex allergy, which might be responding in a linear way. So your first exposures are 1, your second exposures are 2 or 3, etc. in terms of its severity until you finally can't wear latex gloves. But if you're adding immunoexciters, you might go from 1 to 2 to 4 to 8 to 16. And before you know it, if you're talking about wearing those latex gloves and taking vaccines at the same time, you might have immunoexcited yourself into an acute condition. And that could be for wheat, and that could be for dairy, and that could be for dust and pet dander and mold. Could be for anything. So that's the danger in the quantity of vaccines we're getting now and what we might leap to in terms of putting a lot of immune synergizers into things to handle disease quickly. And both dimensions, and Ron, you're completely correct. You could be inflaming the disease on one side, and on the other side, you're administering the deadened virus for the same vaccine and immunoexciter. It could go in any direction and not a virus at all.
Even that, yeah, exactly. So it's very delicate to do these vaccines.
Yes, I might add, yes, a lot of problems can happen there too. But one hard fact is that, for example, look at COVID-19. In a short 4 months, we've already seen tens of thousands or more deaths.
Correct. And
severe morbidity. And also, what I read was that the economic damage globally has passed $1 trillion. That's all only happened in 4 months. So like I mentioned earlier, for a vaccine to be available, it will take at least a year or 2 or even longer. So clearly, vaccine is not a complete package for us to prepare for the next or even for the current and next one. It's only part of the package. And there's always there's always a period of delay when a new epidemic breaks out. And by the time we have a vaccine, assuming the vaccine is available and used for no side effects. So how we are going to deal with this delay? Like I said again, here in COVID-19, 4 months, we've seen such damage. How many times of damage like this can we handle?
And so your economic number is way undervalued. If you take just U.S. damage alone and match it against, forget about the economic downturn, the U.S. government has mobilized how many trillions of dollars right there, U.S. alone, plus economic downturn, plus money multipliers and long-term effect. And you might have collapse in insurance industries, and you could have a lot of problems that we can't anticipate now. We might have a permanent problem with the healthcare system because of people not wanting to participate or can't participate. We cannot even calculate the tertiary effects yet.
Well, don't forget that there's initiatives going on to provide vaccines for this and other conditions in Africa and places like that. And when you deal with people who already have a compromised immune system because they're not getting enough to eat in the first place, what a vaccine could do is cause an epidemic of vaccination, because there's a book called Every Second Child by a doctor from Australia from quite a few years ago, 30 or 40 years ago, who discovered that vaccines to the native people, the Aboriginal people in Australia, was killing 1 out of every 2 children. So it's very fine for us to put this in dollar terms, but it's also to look at the human suffering that's already beginning around this phenomenon in Africa, especially, where you have such a tremendous loss of life from just adding insult to injury in their.
We're not looking at Alzheimer's and dementia. We're not looking at the impact of fat soluble mercury. Even though it's not in the blood, doesn't mean it's not bioaccumulating in myelin and brain tissue. And then you have to look at the issues that are, we don't have a political paradigm in the United States that allows for cord blood testing to determine who's genetically predisposed to vaccine injury. And we can isolate that group and delay at least until they're further down the toxicity curve so that we can delay vaccination until they're of greater weight. So we don't allow that as a paradigm for those people that are clearly in a genetic risk group at times of non-pandemic. So we have a lot of flaws in vaccine politics. Even if this vaccine was as safe as other vaccines, this proposed vaccine for COVID-19, if it was as safe as other vaccines on the market, we still have not handled the politics of what we do to children with vaccines when they're in a risk group. We've gone the other way in America. We're pushing towards more mandatory, less parental choice, more required upon entry into education, which also includes daycare, universal pre-K. They're insisting on giving these kids vaccinations when their body weight is low, when they might have nutritional deficiencies, as you're saying, Ron. And this is synergistic effect of what is in a vaccine to make it work. Synergistic negative effect. Just encephalitis and all the other things that occur for some populations because of vaccines. It's very, very dangerous. It's not scientific. And a child dose is the same in America for an 18-year-old who's a linebacker on a football team versus a 6-month term preemie. It's the same. There's no infant dose. So when people say they don't understand or they haven't calculated, why are some people having injuries and why not? And why is it a bad idea to give it to certain groups? Why is the dose the same for some child that's dozens of times the weight? Why is that?
Well, don't forget that, you wouldn't know, but one of my best friends had the polio vaccine in the 1950s. And he and his brother got both from a bad batch. They got macular degeneration, and they both went blind from the vaccine. And whereas Dr. Klinner, who is the one that originally inspired my friend, pioneer Bob Cathcart, Dr. Fred Klinner in North Carolina, in the late 1940s, when an epidemic of polio came around, he took young children, say 5, 10 years old, and with the appropriately weighted dose of vitamin C, had them cured with no long-term side effects or, residuals, no residual effects in a couple of days. And he was probably the first one of the very first anyway, in the late 40s that used vitamin C intravenously. He figured out the pH balance, the salinity balance, and gave those. And then Bob followed in that vein. And so forth. I wanted to come back to another point related to this because I want to introduce a way of communicating to the outside world. We all know that Columbus sailed the blue in 1492, and when he got over to the Caribbean islands, by that time he'd lost people to scurvy. I forget the number, but even Columbus in the very first voyage encountered this, which was a big surprise because they didn't realize that they were going to face this. And so it normally takes about 30 days to reach the point because you lose about 3% of your vitamin C every day. Now, if you look at these viruses, what they do is effectively they accelerate scurvy. And so I'm going to make the observation that essentially if you start up here where you have a good, strong immune system, you start out and you get hit by this virus, instead of it taking 3 weeks for you to reach the point where you have scurvy effectively, your system is so depleted that it can happen in a much shorter time frame. Now then, furthermore, if you get to the point of sepsis from pneumonia in this particular virus, your immune system is so depleted in terms of just vitamin C, your white blood cells are not getting what they need because there's 80 times more vitamin C in a white blood cell than it is in the rest of the bloodstream on a volumetric basis. So therefore, it is incredible that we could take a person into the and operate to the ICU or even just to the emergency room and not give them, the very first thing has to be to give them vitamin C to bring that element up in and of itself. And so you really have to reestablish the simple matter of having enough vitamin C to give the original function and to avoid the sepsis, which is really very much the same as scurvy, because your organs are starting to fall apart, your body is going down, and the end result of scurvy is basically everything in your body just literally falls apart.
Liquefies because your collagen's falling apart.
That's it.
But also your point is very clear, because people who are coming down with COVID-19 are also winding up with very low white cell counts.
Well, that's
happening.
That's the point, is that the white blood cells with their vitamin C in them are going out, and they're doing the free radical scavenging and taking upon themselves that responsibility. And if you don't restore that, I don't care about any of these other attributes or any other things you might blend in with the the secret sauce. The key thing, as I see it, is there might be other factors in this, but you cannot possibly fight this off if you don't have enough white blood cells, and if they don't have the vitamin C, they can't do the job at all. So you show up in the emergency room, the first thing is to bring in vitamin C.
I agree. And also on COVID-19, raise the temperature. Just raise the temperature. Put them in a room that's 78 degrees.
Now, it's clear that vitamin C has been used clinically, and particularly in the Dr. Paul Merrick and Dr. Alpha Barry Fowler and others in the United States in academia. They've shown, and many others as well, is that vitamin C, high dose vitamin C, definitely clearly prevents and treats, improves pneumonia, ARDS. High dose vitamin C clearly reduces mortality and reduces the stay at ICU in the hospital. These are all vitamin C treatments of these clinical mechanisms or symptoms rather than pathogen specific. And we are seeing preliminary data on COVID-19 as well. So there's abundant evidence over there. And also vitamin C, very importantly, is very safe. We're not doing damage. We're not going to do any damage to patients. Now, the question here is that we need to let more people know about it, and how we can, that's the thing. Right now, as of 3 days ago, the good news is that there are already 12 clinical trials registered at clinicaltrial.gov. That's on high dose vitamin C on COVID-19 treatment. And I'm hoping that, because we are all in the same boat fighting against COVID-19 worldwide, whether we are government, medical, pharmaceutical, or people, we're in the same boat. We're all affected. With this kind of, like you mentioned, trillions and trillions of dollar loss, nobody, very, very few people are benefiting from this, So we need to, hopefully, we can have the consensus here is vitamin C is safe and very promising. I like to see this to be more widely used, not only now, not only in the treatment of moderate to severe cases of COVID-19, but also on the average people, as you mentioned earlier, So there's clear evidence of oral vitamin C in the prevention and the reduction, treatment of these diseases, So for people with mild cold or viral infection or even COVID-19, if we take a high doses, frequent and high dose of vitamin C by mouth, you should be able to either prevent or minimize or reduce the symptoms.
Agreed.
And preventing you from getting to more severe cases. And that's for the mass public out there. That's the important message, along with vitamin D, zinc, magnesium, and these other agents.
So, Richard,
So how can we?
Back to that question I was asking earlier. I've read from your writings and some other information that so far I know that the region around Shanghai is adopted the protocol, and
Yes,
and also in Guangdong near Hong Kong, the province near
yes.
Hong Kong. I'm wondering how far has this propagated in China to this time? Is that those provinces, or is
Well,
it?
like okay, yes, you're absolutely right. And I didn't mention that. So you mentioned about my relationship over there, and I'm involved with all these high dose vitamin C treatment groups or trial groups. Some of them I'm involved in the design and critiquing their protocol. So I'm intimately involved, to answer your question there. And also we've been encouraging many other groups of starting their IV vitamin C trial or use. So actually in China, high dose vitamin C usage is more widely used than I originally anticipated. So that's that. And coming back to your question now is that yes, the Shanghai and Guangdong governments officially included high dose vitamin C in their standard protocol in COVID-19 treatment. Shanghai is one of the 4. Okay, let me explain a little bit about China's structure. In the United States, you have a DC, which is directly under the Congress, and of course DC has other issues. They didn't have like a voting or something, but here there are 4. It enjoys a state level importance. Actually, probably more. Shanghai, Beijing, Tianjin, and Chongqing. Those are 4 cities that are directly under the central government leadership. Guangdong is the southern province that bordering Hong Kong and is one of the most economically developed provinces in China, on the top 3, GDP-wise, and very important. So these 2, I mean, both Shanghai and Guangdong are at the same level or similar level of importance in China, so to speak, GDP-wise or financial-wise. So these 2 governments, basically, it's the medical association of these governments. You have to understand, in China, these medical associations represent the government. Okay, right. So it is the government. So right. And like in the United States, you can have medical association that's totally private or civilian, and nothing to do with the government. Here, it is the government. So these 2 governments are the world's first ones I know endorsed high dose vitamin C in the treatment of any disease, COVID-19 here in particular.
It makes sense.
Yeah.
But what about Wuhan? Is the government there on board, or are they still not?
Well, Wuhan is interesting. And let me say, now I have not seen a medical association. Now, Wuhan is interesting. Let me explain a little bit. Wuhan is the epicenter.
Right.
And so there are a lot of, when the situation was very dire in Wuhan. So what happened in China is that, because suddenly there are a lot of patients and tens of thousands of patients, and Wuhan's healthcare facility couldn't afford to take care of all of them. So every city or state in China was offering these medical support. So they were sort of, okay, Shanghai was taking care of one area, that kind of thing. So that's an area with lots of medical authorities over there. That's not really a centralized thing. Let me put it this way, and I don't want to get into the politics, you know, I try to stay in medicine, is that the one of the top figures in this medical field, I don't really think he believes in vitamin C. Let me put this mildly, okay? I've never heard him commenting on vitamin C. So there was one hospital who published a consensus statement, and in that hospital, they didn't hide those vitamin C in it. And that expert's guidance, because he didn't believe it, so he wasn't involved, I know. There was also another province here, south of Shanghai, Zhejiang province, which is also the top 3, I think, GDP-wise in China. And let me put it this way: this is the home state of Alibaba, you know, the big company.
Yeah, right.
And so I read that statement. They didn't have a high dose vitamin C in it either. So these are all some of the things of my observation, and you know, as you know, and you know, but anyway, no. The answer to you is that all I know of is Shanghai and Guangdong published their official recommendation, including high dose vitamin C. To me, that's good enough. That's good enough.
Okay, any closing words, gentlemen?
I might add, actually.
Oh, I'm sorry.
Yeah.
Go ahead.
Yeah, I want to mention, highlight again, is that what I mentioned earlier is that, again, you know, I am not against any other effective prevention or treatment measures, as long as they are safe and effective, okay? I'm not experts in those fields. People ask me, how do I feel about traditional Chinese medicine? I say, I have no comment because I'm not expert. I stay in my own field, and I recommend what I know of. And so the fact I know, I mentioned earlier in this program here, is that there's always going to be a lag between an onset of a new epidemic and a effective specific antiviral vaccine or these drugs coming out. Now, how are we going to deal with this lag? You know, like, again, 4 months of COVID-19, we already lost a lot. I don't like to see this happening again. So my point is, please, this is, we are in the middle of the COVID-19. We still have chance. Let's use other measures. Give other measures a fair look. Here I'm talking about integrative or also molecular view and approach. That includes vitamin C, vitamin D, zinc, magnesium, selenium, all these natural defense system of our body. And I think this should have a fair place in treatment of this. I am not again excluding other drugs. For example, the hydrochloroquine. That seems to be effective in some ways, and there may be some proposals out there is that it goes through enhancing zinc's ability. Okay, so here it's through the zinc, it's not by itself. So to me, is one of our portfolios, our toolbox is the integrative medicine approach. We should have this in place to help us to prevent you know, the COVID-19 from those who haven't got it, and also in the future as well, because hopefully we will not see another major pandemic hitting us like what we did here, because I don't know how many times we handle this. This is really very tragic, you know, personally, and everybody involved in the United States. We are mostly involved in in one way or another in the stock market, and we're all suffering losses there, you know. Well, thank you very much for having me on the show.
Thank you, Dr. Cheng. Ron, any closing words for you?
Well, I just want to simply say that I very much appreciate what you're doing, Greg, to get the word out. And I think what we're going to be doing now is every time we get a success and we get a breakthrough in which a doctor group or a hospital group or a region like the Shanghai region takes this on, I think we add this up, and as we see success and others see failure, we're going to rise above this, and for the next epidemic or pandemic, we will have the track record And this may really be a turning point. And I'm eager to see this play out well, because we really need to get back on our feet again. And I think the only way that we're going to succeed in that ultimately is sharing our successes and examining where we missed the boat and move on a cooperative basis. And Dr. Cheng, Richard has been very thoughtful in that. And in our private conversations, we're discussing ways that we can develop an international collaboration and support those who are making this happen. So that's a very commendable step in the right direction. I look forward to this unfolding in a constructive way for those who have family and friends that need support.
Well, I thank both you gentlemen for your commitment to humanity. And I would add one more dimension, which is we need to get back to basics in a way. We've become so sophisticated, but we don't provide doctors enough training in the importance of fundamental nutrition, especially in antioxidants, vitamin C, D, zinc, selenium, antivirals like L-lysine. Some of these things are foreign to some practitioners, and certainly it's not included in continuing education. So we're not changing the oil in the car, so to speak. And you can go a long time on dirty oil, but sooner or later the car seizes up. You could fool yourself, or you could change it half as often or 1/4 as often, and you'll still get a lot of life out of that car, but it's not going the distance. So we have to look at basics as well. The temperatures in Shanghai and Wuhan will be in the 80s within the next week. That's not true for New York. It's certainly not true for the northern states. So our government in America has failed to realize what a flu season is. And it's not just vitamin D. We overthink that, because there's a lot of people that work indoors and don't get the vitamin D, or they're members of communities where they're tightly clothed. So they might be in a Hasidic community, Jewish community, and they have a lot of clothes on. The women wear long dresses and they cover up a lot. They could be in a Muslim community that covered up a lot. So it's not vitamin D either. We're looking at a very basic variable here that nobody's talked about, which is simply temperature. Nothing else than temperature, incubation of the virus, incubation. And we've ignored that completely. Yes, vitamin D important. It is definitely a correlate, but just temperature. So people just need to warm up and pretend it's a latter part of the season in the northern states around America, or other parts that are cold right now. That will attenuate this. I'm predicting that we're going to see a gross drop-off in infections in Shanghai and Wuhan, just because it's going to be in the 80s within a week. So let's see how that plays out. But we have all missed that, looking out and looking for the indicators. We forget that there's a flu season. And how do you explain that Muslim women aren't transmitting flus through their family? That might be covered up in the US or in other places. It doesn't make sense. They're not getting vitamin D. So I thank you, gentlemen. And we do need to do exactly what we're all talking about in orthomolecular medicine, which is focus on vitamin C. Vitamin C has multiple doses. We have an anti-scurvy dose. We have a maintenance dose. And surely we have a therapeutic dose, which is what Dr. Cheng and others and the people at the Orthomolecular Journal are discovering and trying to proliferate so desperately. This therapeutic dose of vitamin C that wipes out a lot of disease and is prophylactic in all viruses. So this is so very, very important. And I thank you, gentlemen, both. And we need to set the history straight. As Dr. Cheng points out, there's thousands of studies in support to focus on the ones that were against vitamin C because they had the wrong population or the wrong dose, or there were other things that were skewing the result. We have to look behind that, but we certainly have to move on to realize the upside of vitamin C. And thank you, gentlemen, for focusing on that and making that happen. Thank you so much. Good night.
Thank you both.
Thank you.